Hello and welcome to Arirang TV's special coverage of the COVID-19 pandemic. I'm Min San-hee. Today marks the 100th day since Korea reported its first case of the virus. And while the outbreak appears to have been brought under relative control here, health authorities are calling on members of the public to remain cautious given the possibility of a second wave of infections. Let's begin Tuesday's edition then with the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
Hi.
So let's begin on the domestic front.
All right. Well, as you mentioned in the opening, today marks the 100th day since the first COVID-19 outbreak here in Korea. And the government looked back at the battle against the virus throughout that period. At the earlier briefing at the Central Disaster and Safety Countermeasures Headquarters, senior health official Yoon Tae-ho said there have been big and small crises in the past 100 days. But thanks to everyone involved in quarantine measures, not only officials and health workers, but also the nation's people, the country has come to the point where new daily COVID-19 cases are hovering around the teens. He also asked for continuous responsibility and efforts during the upcoming holidays starting on April 30th, as well as abiding by social distancing measures which are in effect until the end of the holiday period on May 5th. He called on the public to refrain from unnecessary gatherings and travel, noting how Korea and its people's response have been evaluated as a role model in dealing with the pandemic.
All right, so you mentioned the number of new cases hovering around the teens. Is that also the case today?
Yes, we do have a slight rise compared to yesterday and the 2 days before. But if we take a look at our table, we have 14 new cases this Tuesday, which brings the total to 10,752. The death toll stands at 244, and 90 people have been discharged from hospital with fully recovered now at 8,854. And let's take a look at how the situation has developed in Korea over the span of 100 days. Following the first case in January, we hit the peak at the end of February following a super spread in Daegu, which the government mentioned today again. And from March to mid-April, we were hovering around 100. And for the past 10 days, cases have stabilized to the teens.
Meanwhile, on the global front, so the total number of infections, I understand, has reached a new milestone.
Right. We have now more than 3 million cases around the world and with over 211,000 deaths. And the U.S. accounts for a third of those cases as it has surpassed 1 million now, as we can see here on our graph, on our table. The U.S. has also some 56,000 fatalities, followed by Spain and Italy in total cases. France has now more cases than Germany and the UK, and a similar death toll at more than 23,000 as Spain. And Russia has become the next country that has more infections than China, and China and Brazil have more than 4,600 deaths. But those are the places where we aren't for sure that the official tally is the actual number, especially in many places in Latin America, because they are lacking test kits to actually conduct all of these tests.
And speaking of Latin America, I understand social distancing is virtually impossible at prisons there.
Overcrowded prisons are one of the growing concerns in Central America and South America, with some 1,400 infections reported at prisons in the region, and around 1.5 million people are held in Latin American prisons that provide perfect conditions for a highly infectious virus like the coronavirus to spread. Inadequate facilities and hygiene situations, as well as lack of staff, are results of low budgets. More than 300 cases were reported in a jail with some 1,100 inmates in downtown Santiago, Chile alone, with prison staff saying everyone's in contact with each other. And earlier over the weekend, authorities in El Salvador ignored social distancing recommendations and crammed prisoners while searching their cells, which we are seeing here in the footage right now. Peru has now more than 600 prison-related cases with at least 13 deaths. The Dominican Republic reported at least 239 cases when it tested more than 5,500 prisoners. The fear of the virus spread at prisons is why some prisons in Chile, Colombia, and Mexico are releasing prisoners. And at some prisons, inmates are actually escaping en masse. For instance, in Brazil, more than 1,300 fled a prison following a cancellation of a temporary release program.
Oh, I see. So, all right. Thank you for that. I'll get back to you after the regular briefing. Aram, Korean health officials believe there could be more cases of COVID-19 here than reported, and they're thus looking for methods to change they're looking to change testing methods, I understand.
That's right. One of those testing methods is an antibody testing method, and Korea CDC is reviewing that method and are in discussions with experts on how to administer it and methods associated with it. And now, antibody tests have garnered attention globally, in fact, lately, because they're designed to show if you've ever had COVID-19, even if you never had any symptoms or knew you were infected at all. And the government wants to know how antibodies are formed and therefore get a better picture of how to fight the virus. So this will be used for research purposes, and the KCDC says these antibody tests will be used for that purpose rather than to actually test for COVID-19 cases. Also, such tests gives health officials a better picture of how many people have developed antibodies, and this can give an estimate of where if there is a possibility of what is known as the herd immunity, where a vast majority of people are immune and so develop a vast herd immunity, as the name suggests.
Right. Moving on to Paris, I understand that work efforts to restore the Notre Dame Cathedral are back on track, Aram.
That's right. The coronavirus outbreak had forced the restoration work on the fire-torn cathedral to be put on hold for just over a month now, and workers did return to the construction site on Monday to make it compliant with new social distancing rules so proper work could resume. Showers for workers would be modified and changing rooms adapted to reduce the risk of infection. So those are the measures being implemented and worked on first. As we know, a massive blaze burned through the iconic building last April, destroying the roof and the iconic spire along with it. President Emmanuel Macron promised to rebuild Notre Dame Cathedral within 5 years, but progress has been slow. Besides the pandemic, toxic lead and winter storms last year had also hindered the reconstruction efforts, so it's not looking very good at the moment in terms of progress of reconstruction.
And in the UK, the Prime Minister Boris Johnson is back, and he's warning that this is not the time to ease lockdowns.
That's right. In a speech outside 10 Downing Street, the first time he was speaking since recovering from the virus because he contracted it himself, he urged for patience and noted that it's too soon to take risks. Have a listen.
And so I know it is tough, and I want to get this economy moving as fast as I can, but I refuse to throw away all the effort and the sacrifice of the British people, and to risk a second major outbreak and huge loss of life and the overwhelming of the NHS.
Quite the passionate speech there, and he added that any changes to the lockdown will be set out and announced over the coming days. The UK's lockdown measures are due to be reviewed again by May 7th, and they may be extended following those passionate remarks by Prime Minister Johnson. The Prime Minister also said there were real signs that Britain is passing through the peak, noting fewer hospital admissions and fewer COVID-19 patients in intensive care. But he did stress that even if the spread slows, restrictions will be gradually eased, as we've been seeing in Korea as well. He said the UK would be ready to enter the second phase of the fight against the virus after Britain passes 5 tests for easing restrictions. Those include a consistent fall in the death rate and making sure the National Health Service can cope.
Right, Aram, thank you for that. We'll see you again tomorrow. We are poised now to join the regular afternoon briefing by the Central Disaster and Safety Countermeasure Headquarters on the COVID-19 situation here in this part of the world. While the number of new cases remain within double digits, health officials are calling on members of the public to remain cautious, especially ahead of the so-called Golden Weekend. Now, this Thursday is a holiday here as Koreans celebrate Buddha's birthday, which will give way to Friday's May Day and then the weekend, followed by next Tuesday's Children's Day. Officials are expecting a large movement of people within the country as many seek to make most of the holiday, having spent quite some time indoors in light of the social distancing campaign. Meanwhile, this campaign is poised to make way for the daily life quarantine initiative, in which schools and workplaces are poised to open doors, albeit gradually. We are still waiting for the start of the interview as we have yet to see officials approaching the podium. So perhaps while we wait, we could take a look at the daily toll for new infections here in Korea as reported by our Kwon So-ah. I understand we have 14 new cases today, raising our total to 10,752. One person lost his or her life, raising our death toll to 244. Now, the numbers are relatively stable here in Korea, which is why our social distancing campaign will be eased. But yet at the same time, the officials here are calling for much caution, as I mentioned. Here now is the briefing. We'll come back to you after it.
Let us now begin our regular briefing for April 28th, Tuesday, on the coronavirus outbreak in South Korea. We have a total number of confirmed cases that stands at 10,752. Of them, 8,854 have been discharged. And the imported cases stands at 1,056, and 91.1% were South Korean nationals. As of yesterday, we had 14 new patients, and we had 90 more people who were recovered. And unfortunately, we had one more fatality as of yesterday, and I send my deepest condolences to the deceased and the members of the bereaved family. And let us now look at the regional breakdown. Out of the 14 cases, 12 of them were imported cases and 2 were community infections, one in Incheon City and one in Gyeongsang-buk-do Province. Nationwide, 80.6% are related to cluster infections. And looking at the sources of infection during the past 2 weeks, we had a majority of them as for the imported cases, and the next was followed by cluster infections among regions, standing at 15%, and 11% were also related to nursing hospitals. And we had 12 imported cases, as I just mentioned, and 6 of them were from Europe, 2 were from Americas, and those from the Philippines, Singapore, Arab Emirates, and Pakistan were also categorized as others. And 9 of them were South Korean citizens. At the city of Incheon, and we have one more tested positive, who was one of the family members of the imported cases. The KCDC looks to and will monitor the possibility of a possible outbreak as we enter our golden holiday week. And if you have symptoms or if you feel sick, please refrain from traveling. And even if you do go on traveling, please move in small family units, drive your own car, and please refrain from going to crowded tourist destinations. Even during your travel schedules, wash your hands thoroughly and cover your cough with your sleeves or elbow. And please keep 2-meter distance with each other. And please refrain from going to enclosed and crowded places. And if you have to do so, please wear face masks. And while you are traveling, please avoid from gatherings. And after your travel schedules, please stay at home and refrain from going outside if you have symptoms like fever. And if symptoms become severe, please call the call center at 1339 or get screening as soon as possible. And we have some words of recommendation for the public. During the past months, we have seen many medical staff members who are fighting at the front lines of the COVID-19, and we also saw great participation by the public, and they have been making the possible accomplishments that we have achieved so far. However, we are seeing a prolonged outbreak and we are not yet near a termination of the outbreak. And also, 2 days before you show symptoms, these are the periods where you could have high infectious risks. And also there are infections among asymptomatic people. And it also has been tested that one person could lead to about more than 40% of infectious rates. The COVID-19 is a very silent disease and it is a very complex one as well, which is very hard to deal with. The quarantine authorities, we are trying to analyze the immunity rate with our antibody, and I don't think that we will have a higher rate. Even if we have a higher rate of antibody development, this does not directly mean that we have developed herd immunity. Moreover, going forward, we will conduct and utilize diverse platforms, and even if we have an effective therapeutics and a vaccine, when these are used in wide scale, we believe that we will be immune to such vaccines or therapeutics. In comparison, we are just not yet nearing the peak of the first mountain. However, we believe that we have many more to come in the near future. And that is why we are not letting our guards down. This moment is a moment for us to focus on social distancing and conduct wide-scale contact tracing. And we need to focus on identifying all of the patients at early stage. When these efforts would come to a close is not sure as for now, but they need to be continued until we have a successful vaccine development. As for South Korea, we are now in the 13th day after we had our nationwide general elections. And even we are also minimizing cluster infections right now, despite the fact that we are seeing cluster infections at some of the nursing hospitals or medical centers, where many of our senior citizens have been infected by the disease. However, we are yielding great results that we have of the effects that we have put in place so far. So we believe that when we continue to execute social distancing measures and when we transition into our everyday life quarantine, we can decrease the risk of another cluster infection, and we can have a certain control over sporadic infections. And the fate of the COVID-19 lies in the hands of us. Last but not least, there are many people who have been exerting their dedications to combat the COVID-19. They are also trying their best to cooperate with the trial clinics going forward. And I extend my deepest gratitude to all of them once again. And also for the people who have been treated, many people have been donating their plasma, and I want to thank them again as well. Thank you very much.
Right, that was the government's afternoon briefing. So do give us a wrap-up of the key announcements.
All right, Vice Head of KCDC Kwon Junok said that today we have, again, 14 new cases. And out of these 14 new cases, 12 are imported cases and only 2 domestic infections. And what's notable is that out of the 12 new imported cases, many of those could be from the metropolitan area, because today we see 4 new cases in Seoul and 3 nearby in Gyeonggi-do province. So half of today's cases are from the metropolitan area, meaning some of the people that entered the country probably have been self-isolated in the capital and outside of the capital. So the most populated areas are still vulnerable to the virus. And also Kwon made a message to the public asking for people to still abide by social distancing measures until May 5th, and also to make sure to follow hygiene measures, especially when you're traveling. sharing. And at the end, he also expressed his gratitude towards people who made plasma donations, those people who were treated for the COVID-19 virus.
All right, Swa, thank you for that. We'll see you again tomorrow.
Thank you.
Now, in this next segment, we travel to the United Arab Emirates, where Ramadan is underway and Muslims observe the holy month by fasting and sharing. Now, this latter act of compassion comes at a particularly difficult time as the global pandemic calls for strict social distancing and other quarantine measures. For a glimpse of the situation in Dubai, we have this next video.
Hello, my name is Chang Eun-ha. I'm living in Dubai for the past 4 years. There is growing number of COVID-19 patients in Dubai. It's nearly impossible to buy filter mask here. Only dental masks can be bought at pharmacy, but they are now being sold for around 50,000 won per box, which is more than 5 times the price they were sold at before the COVID-19 outbreak. Recently, South Korea exported 50,000 test kits to the UAE, which has been well received by the public in Dubai. Crown Prince Mohammed said that he deeply trusts South Korea's response to COVID-19, including its proactive quarantine measures and outstanding competence in other areas. In light of these developments, I could see that South Korea was being well regarded as a global benchmark in the fight against COVID-19. Dubai is a country that relies heavily on tourism, so travel agencies, restaurants, shopping malls, and other service industry sectors have been hit very hard. The government here has taken strong countermeasures to contain the spread of COVID-19 and has announced that anyone who spreads false rumor about the virus could be punished with life imprisonment. A 2-week lockdown order has been also issued since April 4th, and ordinary citizens can only go outside to visit pharmacies, supermarkets. If you need to go outside, you must go to this website and apply for permission. Only after it's been approved can you step outside your front door. Also, police officers will stop anyone they see outside and learn their social security number through their database to make they have gotten permission. As you can see, the streets are nearly empty. Most businesses have been closed down except for a few delivery services. You can see how the COVID-19 outbreak has turned life upside down here, simply by walking around. I don't feel very comfortable about filming any more of this, so I'm going back home. Currently, the lockdown in Dubai is slowly being eased as it marks the holy month of Ramadan. However, it's possible that we could have a surge in new cases during this period, which is why the government has ordered the closure of the mosque and asked people to pray at home. We will need to stay cautious moving forward. I sincerely hope that this crisis will eventually pass in Dubai and the rest of this world. I really come to appreciate just how easy life was back when everything was normal. I do hope those days will return soon, and I make sure that this pandemic will come to an end if everyone comes together to make an effort on their part. Testing kits supplied by Korea are so helpful to UAE to stop spread of virus. We appreciate Korea. This has been Chang Eun-ha from Dubai. Stay safe, everyone.
Now, it's been 100 days since Korea reported its first case of COVID-19, and after witnessing a daily peak of more than 900 infections in late February, the country is now recording a relatively stable number of less than 15 per day. In our first studio discussion, I have two American exchange students studying at a local university in Seoul for their first-hand account of the contagion and containment here in Korea. Welcome to the studio.
Thank you for having us.
Perhaps we can start with a brief introduction. We'll start with you.
Sure. My name is Margaret. I am an exchange student at Kyung University from Northern Michigan University in the United States.
Good. Nice to meet you, Margaret.
Nice to meet you.
And you are?
I am Garret. I am also a Kyung University exchange student from California University, Sacramento.
Welcome. Margaret, we'll start with you then. In the early stages of the global outbreak, Korea appeared to have the second most number of infections outside of China. What made you stay instead of leaving Korea?
Well, first of all, I wanted to stay. I really love it here, and I like going to school here. But also, I felt safe here. I trusted that the situation would be handled well, and if I did get sick, I'd be able to get tested and treated.
I see. Garret, I understand you received an email from your university back home advising you to return. You replied with a letter detailing your reasons to stay. What were your reasons?
Yes, that's correct. And actually, it wasn't an advisal. They were demanding that I leave. But I really wanted to stay here. I had 4 reasons to stay, which was first, my health. I don't have health insurance in the United States, and I could get treated here if I did get sick. The next was my academic success here. The university, my home university, was 2 months in already. So if I went back, I would be behind, whereas the university here hasn't even started yet. Next is financial. I have a deposit in a apartment right now, so I couldn't just leave right away like they wanted me to. And then last is just my mental health. Everything was very stressful, trying to figure out how to get back as soon as possible like they wanted me to.
I see. What was the response of your family and friends with regard to your decision?
Well, my mom was a little apprehensive at first, but I assured her that Korea was taking care of this situation very nicely. They didn't drop the ball like the United States did, so actually I felt genuinely more safer here than in the United States. So I reassured her that I would be safe here.
Margaret, do you share Garret's thoughts about the safety here in Korea? Do you believe the country handled the issue properly?
Oh yeah, compared to the U.S. especially.
Would you care to elaborate?
Sure. I think that, in my opinion, our national leadership didn't do a very good job in being truthful or productive in spreading information about the virus. I think we'd have a lot less cases if we would have addressed it as early on as Korea did, and if our citizens followed the rules.
How are your family and friends back in the U.S.?
My state is on lockdown, which means that most of the businesses are closed and people are told to stay home. So I have a family of 5, and they've all been at home for about a month now. But they're doing all right.
Is there a message you'd like to share with them through our station?
Just bye, love you, miss you, see you soon.
What about you, Garret? A few words for your family and friends.
Yeah, I'm excited to see them when I can, and I hope they stay safe in the United States, and that I will be safe here, and that I will see them when I do. I love them all.
All right, Garret and Margaret, thank you very much for your
Thank
time
you.
here.
Thank you.
Having brought the COVID-19 outbreak within relative control here, Korea is now seeking to share its know-how and equipment with its counterparts worldwide. For more on its humanitarian initiatives, that is, I have Director Chang Eun-ha from the Korean Women's Development Institute. Welcome, Director Chang.
Thank you. Good to be here.
Thank you for being here. And I have freelance journalist Jason Strother. Hello, Jason.
Hello.
Director Chang, we'll start with you. Quite a number of countries have been calling for humanitarian assistance from Korea, and the country is, according to media reports that is, planning to help 14 countries. This includes a $2 million quarantine-related supplies shipment to Iran. What are your thoughts on these humanitarian efforts?
Well, to begin with, humanitarian aid is an effort trying to save lives, alleviate suffering, and maintain human dignity. And as a country that has first hit by this virus, but relatively well is stemming this pandemic, and also has the capacity to help others, I think this is South Korea's moral and ethical responsibility to help others. And I heard that South Korea is the government and also the MOFA and the KOICA, they're helping. They're cooperating with each other to send this humanitarian aid, and they're very, very, very busy. I think this is a new opportunity for South Korea to upgrade their leadership in global community. This will be a great chance.
Jason, Korea's shipment to Iran was made possible after a sanctions waiver by the US. I'm sure the international community welcomed the US decision in light of the pandemic.
This is the kind of thing that should be happening during a global pandemic. Now, of course, tensions between Iran and the United States remain high. If the U.S. is waiving some of these sanctions to allow humanitarian aid, and that's a good thing. Iran has been hit very hard by the coronavirus. But the U.S. also has reportedly is allowing waivers for humanitarian aid to other conflict zones like Syria, other adversaries, Venezuela, and North Korea. But I think it remains to be how difficult are the hurdles to get the waivers. There's a long process that often goes into supplying these countries with humanitarian aid.
Director Chang, in addition to securing a sanctions waiver for Iran, Korea also managed to get a ban on business travel for Koreans lifted in Uzbekistan. Right. How do you assess these fringe benefits, if I may call them that, for Korea amid its initiatives to assist its global neighbors?
Right. Actually, if you look at closely, this is humanitarian aid, but there are also trade transactions. So meaning we give them this aid for free, but for some countries, they buy it. They buy these test kits and health equipment from us. I think this is basically on the principle of quid pro quo, meaning that it's reciprocal. If we can help others out of goodwill, but then in return, if we can get or if we can satisfy our national interests, I think this is a win-win situation for both countries. And I think this is the essence of what diplomacy could be. So I think South Korean government has been especially nimble this time amidst all this turmoil to act swiftly. And I would like to applaud highly of these efforts.
Jason, Korea has also announced plans to supply its allies with face masks to be provided to war veterans. Do you believe these gestures of goodwill will yield future benefits on the diplomatic front?
We're talking about a 70 or so year quid pro quo right there. I mean, around 20 or so countries sent soldiers back during the Korean War in the early 1950s. So it is certainly a great goodwill gesture that South Korea is doing to provide these veterans with face masks, especially considering most of these veterans are probably now around the age of 90 or older. It's unclear how many are still with us. But of course, this is a vulnerable population, the elderly, so I'm sure any help they can get is much appreciated.
Jason, I'm sure Korea is not the only country that's involved in humanitarian assistance to its global counterparts. Tell us about the efforts of other countries, perhaps.
Sure. Well, the European Union countries in Europe are providing aid. I mean, Iran is not only getting assistance from South Korea, it's also getting aid from, I think, France and Germany as well. Even the United States, which is, considered right now the epicenter of the COVID-19 pandemic, is sending aid to the Philippines. Now, of course, there is a chummy relationship between President Duterte in the Philippines and President Trump. So perhaps that could have its own kind of quid pro quo right there.
Meanwhile, the International Committee of the Red Cross has also asked the Korean government to assist the world's most vulnerable populations living in war-torn regions as efforts to ease their plights continue. Have a listen.
So for the ICRC, we have been very much early trying to adapt our response to reorientate our programs in order to be able to respond to those new needs. And here we have been working in different settings, different angles, and maybe to give you a few examples where we have been working. One of them is to try to prevent and control the spread of this virus in jails, in places of detentions that are often crowded or congested. And in order to prevent the pandemic to reach inside the prisons, we have been putting measures, what we call these IPC measures, the infection and prevention control measures, at the entrance of the jails, inside the jails, to try to prevent the spread inside. And this is done in places where we have been very active, Philippines, Bangladesh, Afghanistan as well. Another very important adaptation we have been doing is on the health centers and health infrastructures to try to ensure that there is regular provision of water, regular provision of access to the population. And here the same measures and prevention and control are very, very important in order to be able to allow people having access to those places. The virtual meeting between your foreign minister, Ms. Kyung, and the president of the ACRC was a very constructive discussion. Different areas of cooperation that could be explored. The assistance to vulnerable population is absolutely key in this COVID pandemic. And they have been exploring together different axes, different areas of work. One of them is the cooperation with the COICA, your cooperation agencies, which is very much already involved worldwide in different type of programs. And I'm sure they have been adapting already a response to the COVID. And we are ready to collaborate further, to analyze further, to discuss together on how best we could collaborate. But so far, this dialogue is very constructive and it's very meaningful in days where we have to work around the clock. The pandemic is very much acute and we need to work together.
Right. Jason, from the perspective of the foreign media, what role might it expect Korea to play in global humanitarian efforts?
Well, I'm not too sure if the foreign media has a particular perspective on this, but I think I can say, as someone who has covered Korea for over a decade now, that it is remarkable that a country that was a recipient of humanitarian aid, foreign assistance several decades ago, is now a leader in providing humanitarian assistance to developing countries, other nations that are in need. So that is a development, and it's something that has developed in Korea over the past decade or so, increasing South Korea's soft power via humanitarian aid. So I think Korea, having experienced being one of the first countries to experience the COVID-19 pandemic, and now is on the mend, so to speak, is in a great position to help other countries that are currently battling the disease.
Director Chang, speaking within your capacity as a former working level committee advisor of humanitarian support at Seoul's foreign ministry, what can Korea do to render better assistance to the global community?
South Korean government has been providing humanitarian assistance as a policy for the past 10 years or so, but the civil society has been involved long before that. They have, about 4 or 5 years ago, they have newly started to focus on providing aid to most vulnerable people, including women, children, elderly, and disabled. So I think South Korea should continue in this direction and look for the most marginalized people under this pandemic. So one of example could be providing aid to the refugee camps. Just imagine a situation where you tell the people to wash your hands, but there's no water to wash. And imagine a situation where you tell them to keep distance, but there's no distance to keep. So these are the people who are most marginalized, who are most affected by this pandemic. And I think this is the direction that we should go. And also, international community is really, really dreadful of this pandemic going into the refugee camps. So I think South Korea should sit down with the international community, like UN agencies, and devise a very creative method to stem this pandemic spread in this kind of world. Yeah.
And what about, Director Chang, how should South Korea go about perhaps in providing relief to its counterpart up north?
North Korea, you
Yes.
mean? Yes. First, we need to get the request from North Korean government if we want to provide aid. But then now that calling is not coming yet, but North Korea has actually asked the international community, the WHO, to provide the health assistance. So for now, I think South Korean government can think about a detour in providing aid to North Korea. So funding the agency that will provide assistance to North Korea. So this may be the short-term method. And when the North Korea actually asks for South Korea for help, so when it becomes bilateral, and of course the most urgent material should be sent first, like masks, goggles, and gowns. But we also have to think about more long-term because North Korean health system, it's in near collapse. And even though if we keep providing these materials, it will only reach a limit. And we should simultaneously think about providing or assisting their system, their capacity, their more fundamental structure of the health
the healthcare system itself.
Right, healthcare system in North Korea.
Director Chang, should Korea adopt any new strategies in pushing forward with its provision of aid to its less fortunate counterparts?
I wouldn't say it's a new strategy, but maybe some direction. So first, I would like to say South Korea should focus not only on health aid, but be more comprehensive in terms of aid package. Because in developing countries, they're not only hit by this health pandemic, but also their income is affected because of this lockdown. So their food, shelter, clothing, they're in danger in every part. Their livelihood is in danger. So comprehensive package. Second, I think we should realize the spirit of sustainable development goals, leaving no one behind. And this is in line with what I've just said before. So going for the most marginalized people, so that we don't leave anyone behind. Third, I would say we should not only give aid, but also think about building capacity so that this aid is not only one-time or temporary, but it can also support their long-term structural needs of the country.
Reminds me of a proverb I once said, don't give them the fish, teach them how to fish.
That's right.
I see. Yeah. Jason, do you believe that the expansion in scope and scale of Korea's humanitarian assistance, the soft power that you spoke of, would it have a tangible impact on its global standing?
Soft power is arguably much more influential than other forms of diplomacy. And I think South Korea for the past decade, whether it be direct humanitarian assistance or K-pop or other means of popular culture in South Korea, has won a lot of goodwill around the world. And I think we see it right here in Korea with foreign direct investment coming in, just migration to South Korea. Many people are now drawn to Korea as a destination to live and to work or to study, as we met earlier, the two exchange students. So soft power has done Korea a lot of good, and this being a part of the response to the coronavirus will, only increase some of the South Korea's soft power potential.
Do you agree with Jason's view, Director Chang?
I totally agree. South Korea has gained all this praise for its economic development, industrialized development, and also recently technology. But now this is, I think, a little bit of a different level where our health system is being praised, where our manpower, our capacity in dealing with this crisis is actually looked upon. So I think this is quite a new leadership. I'm repeating this word, but new level where South Korea can actually exercise some soft power. Yes.
Right, so we'll keep our fingers crossed for that. Yes. All right, Director Chang, thank you very much for your thoughts, and Jason for yours as well.
Thank you.
Thank you.
Right, and that brings us to the end of this edition of COVID-19. Do join us tomorrow at this hour for a look at Korea's innovative triage centres, which are believed to have played a pivotal part in the country's containment of the virus. In the meantime, do reach out to us through our social media accounts or our homepage, arirang.com. Thank you for being with us.
차가운 겨울 그대로 주저앉아 멈출 건